Ever think about like how your mouth is kind of like a warning system for your overall health?
It's true. The mouth can be a real indicator of what's going on in the rest of your body.
Right. And today we're diving into something that a lot of people don't realize is connected addiction and oral health.
Yeah, it's a surprisingly impactful connection, and unfortunately, it's often overlooked.
Exactly. So we're looking at some research today on nicotine, alcohol, and drug addiction, and how those things affect your mouth. Spoiler alert, it's way more than just stained teeth. We're talking gum disease, premature aging, even oral cancer risk.
It's true. Addiction doesn't discriminate. It really does affect every part of you.
Okay, let's kick things off with nicotine. And these days, it's not just about cigarettes. Vaping, chewing tobacco, it's all in the mix.
And the numbers are pretty alarming. 34 million adults in the U.S. alone smoke cigarettes, and over 16 million already have some kind of smoking-related disease.
It's easy to think, it's just smoke, but nicotine is a sneaky one. One thing that really gets me is silent gum disease. What's up with that?
Nicotine actually masks the warning signs of gum disease. You see, it constricts blood vessels, so you might not even see bleeding gums, which is one of the early signs.
So you could have it and not even know.
Exactly. And that means people often don't seek treatment until things have progressed much further.
Wow. It's like it tricks you into thinking everything is fine when it's not.
And on top of that, let's talk about dry mouth for a second. People think it's just annoying, but it's actually a much better deal.
Oh yeah, dry mouth. I've definitely experienced that. What's the problem with that though? Just uncomfortable?
It's more than just uncomfortable. Dry mouth, or xerostomia, creates the perfect environment for all sorts of oral health problems. Without enough saliva, your mouth can't naturally wash away food and bacteria.
Oh, I see.
And that creates a breeding ground for plaque, which then leads to tartar, cavities, and you guessed it, even more gum disease.
This is like a vicious cycle.
Exactly. Dryness leads to damage, which leads to more dryness.
So nicotine not our teeth's best friend, that's for sure. But how about something we usually associate with a good time though? Alcohol. We all know sugary drinks aren't great for your teeth, but what's really going on there?
Well, yeah, the sugar is definitely a problem.
Mm-hmm.
But it's the fact that alcohol is so dehydrating. And remember how we were talking about dry mouth being a problem?
Oh, right, yeah.
Alcohol just makes that 10 times worse.
So it's like a double whammy of dryness. First nicotine, then alcohol's like, hold my beer.
Exactly. And as if that wasn't bad enough, there's also the impact of stomach acid to think about.
Oh, right.
You know, when you're drinking a lot and vomiting.
Yeah, unfortunately.
Well, that exposes your teeth to all that harsh acid, and that's really damaging.
Yikes. Not a good visual.
No, not at all. And then, of course, there's the link between alcohol and oral cancer.
Oh, right. Yeah. People don't really talk about that as much.
It's a serious concern. Alcohol is actually the second leading cause of oral cancer. And the more you drink, well, the higher your risk.
That's definitely something to keep in mind. Okay, so we've covered nicotine, alcohol, but often those things, they can be, I guess, gateways to even harder stuff like drugs. We know drug abuse takes a toll on your body, but you said earlier that the mouth often shows the damage first. What's that about?
It's true. We've all heard that term meth mouth.
Yeah, it's a scary thought.
It really is. Severe tooth decay, tooth loss, dryness.
How does meth actually do that?
Methamphetamine basically shuts down your saliva production.
Oh, wow.
And remember, saliva is your mouth's defense system. Without it, all that bacteria just goes unchecked.
It's like a city with no garbage collection.
Exactly. Things get pretty bad pretty quickly. And then on top of that, a lot of drug users have poor nutrition, which just weakens the teeth even more. It's like a perfect storm of badness.
I know this is a lot to take in, kind of heavy, but the good news is, like, there's always hope, right?
Absolutely. Addiction is treatable, and so is the damage it does to your mouth, especially if it's caught early on.
That's what I wanted to get to. Seeking dental care is a big part of recovery, isn't it?
It really is. So many people don't realize that a lot of these oral health problems, we can totally treat them.
Yeah.
And in some cases, even reverse the damage if we catch them early enough.
That's good to hear. And I just want to say to anyone listening, dentists are trained to handle these situations, with understanding. It's a judgment-free zone.
100%. And beyond that, there are resources out there for both addiction recovery and dental care. I know it can seem overwhelming, but just taking that first step is often the hardest part.
So true. And it's true what they say, taking care of your mouth is taking care of your whole self.
All right, it's all connected. When you take care of your mouth, you're really making an investment in your overall health, like a domino effect.
I like that, an investment. So To wrap up this deep dive, I think the thing I'm left with is this. Next time you think about addiction, any kind of addiction, just picture what it could do to your smile.
It's powerful to think about it that way, yeah.
It's not just about your body, right? It's
Yeah.
about how you interact with the world every day. Something to think about.